So recently, the King County Sheriff Department developed this PowerPoint to introduce Rescue Task Force to EMS, our law enforcement partners, and fire departments as well. This training here is just going to be an introduction, more of an awareness level training. And as we become more aware and more used to this idea, we'll start implementing some practical scenarios as well. So what is Rescue Task Force? Rescue Task Force is something that would be implemented during an active assailant incident. So that could be an active shooter or any type of situation where there would be a violent event happening is when we would use Rescue Task Force. The purpose of Rescue Task Force is to have a team that's consisting of our law enforcement partners and fire department to go in and start assessing, triaging, treating, and extricating patients that have fallen victim to this event. What's important with Rescue Task Force is that it's really focused around our law enforcement and the fire department side of our system, and not so much the ALS side. They have a separate role in this type of incident. So first and foremost, what's very interesting and very promising is that King County Sheriff Department started realizing that in order to properly execute this type of incident, they need to really start implementing an incident command structure. And so something that's been part of their training, and they're going to continue to train on this, is that a unified command center has to be established prior to establishing these other roles like Rescue Task Force and the ALS roles as well. And so we can start to expect some more training coming down the line for them, so that way they're more prepared to interact with our command structure as well when we go to this type of incident. So initially, when there's an active assailant incident, what's typically going to happen is there's going to be a contact team. They have a specific task that they need to complete, and they're going to go inside, start neutralizing this threat. What you notice is that they're not going to be the ones that are going to initiate this incident unified command. That's probably going to happen later on as more law enforcement personnel start showing up on scene. So I wanted to make sure that we mention that the first initial law enforcement members will be going in, and they're considered the contact team. Now, the Rescue Task Force, in order to have a Rescue Task Force, we have to have a minimum of 2 police officers and 2 medically trained personnel. So again, because the contact team are going to be the initial individual showing up on scene to go neutralize this threat, we're going to have to wait for more police officers to get on scene in order to be able to make this Rescue Task Force. So what does a Rescue Task Force look like? Well, it's going to have 3 elements. We're going to have a team leader, and that's going to be our protective element. Our team leader is going to be part of either King County Sheriff Department or another law enforcement agency. And they're going to be the ones that are leading us through a warm zone, which we'll talk about here shortly. But they're going to be leading us through this incident, trying to locate patients. And of course, their primary role is going to be to protect us. Between that first protective element and the last one, we're going to have the rescue personnel. What you'll notice is that that's comprised of fire department personnel, not ALS agencies. The ALS agencies, their role is going to be to load the patient into the back of the ambulance and transport the patient, because we want these patients to be off the scene as quickly as possible, especially knowing that their chances of survival goes up a lot quicker if we can get them to the hospital in a timely fashion. And then leading up the rear here is going to be another protective element, another law enforcement partner that's going to be protecting us from the rear side. So this is what it's going to look like. We're lucky enough to get involved in this Rescue Task Force training early on. And so the King County Sheriff Department made a visit to Station 1 and used our Station 1 personnel to show what this is going to look like. So what you'll notice in the front, here in front of Lieutenant Quinn, is going to be our team leader. Our team leader is going, again, he's going to be protecting us from the front, but also leading us through the warm zone, leading us through whatever incident we're at in order to find victims. So behind him is Lieutenant Quinn. Now, what's important to understand is, despite the fact that we have a law enforcement team leader, we need a medical team leader as well. So in this instance, that would be Lieutenant Quinn. Lieutenant Quinn would be the medical team lead. And so what's important to have with that is that or to understand is that when we enter a room and our law enforcement team leader says, okay, go ahead with this room, I've cleared it for you, it's important to have a medical team lead to direct our members to which patients to head to first, and to gather that information, because that team leader is going to be communicating with other people throughout the scene as well. And then near the back here is our other law enforcement partner who's helping protect us from the rear as well. So in order to activate the rescue task force, we have to have certain thresholds met. So initially, obviously, we need to have a serious or life-threatening injuries being reported on the scene. So we have a possible active assailant. We have reports that there are serious injuries at the scene. And then unified command needs to be established. A warm zone needs to be identified. There needs to be a perimeter set. And proper communication channels need to be figured out as well. So that's really important to understand. We can't expect that as soon as we have word that there's an active assailant that we're immediately going to be activated as a rescue task force. There's certain things that need to be set, and one of the most important things, especially in the fire side of things, is that we have to have a unified or incident command set up to be able to call the shots and coordinate this entire incident. So just like a hazmat situation, during an active assailant, there's going to be a couple zones. So the hot zone is going to be where the actual threat is. That's where the immediate threat is. The contact team is probably there and engaging with that threat. The warm zone is going to be a larger area around there where things have been cleared but not necessarily secured. And we'll talk about what the difference between a cleared scene and secured scene is here in a little bit. But the warm zone is where we are going to be going in and getting these patients. The warm zone is where maybe that active assailant has gone through, and there's patients in that area. And then the cold zone is an area where there is no threat. It's quite a ways away from the actual incident. And so this is what it's going to kind of look like. So this is 5 Mile and Plainfield. Our fire station is right here. So we have a simulation where they have an active assailant here. Contact team would be around here, kind of neutralizing that active assailant. And then, so that would be the hot zone. The warm zone would be pretty much all around that, where we would have patients through there. And then obviously the cold zone is quite a ways away here. So that's kind of what it would kind of look like. So again, just kind of going through the chain of events here. The law enforcement contact team would go directly to the threat and start trying to neutralize that threat. As more law enforcement personnel show up on scene and our command personnel on the fire side starts showing up at scene, we would then initiate an incident unified command. From there, we can start getting more law enforcement and fire personnel to start getting rescue task force organized. We would go into the warm zone, start identifying wounded patients, triaging them appropriately, doing any life-threatening treatment on scene, and then we would extricate them to the casualty collection point. So when triaging the patients, we're going to be using our colored tape. Now, something that's going to be different for us here is that in the past, we've always talked about how dead patients are kept in the same spot. We don't really touch them too much, and we tag them with a black tag. We still are going to tag them with a black tag, but something that's being brought on to the west side of the state that apparently they do on the east side is we're going to start moving patients into the fallen angel position, which you can see here in this picture. This fallen angel position apparently is a universal sign that this patient has also been deceased. So I imagine this is going to be a quick, if another team comes in, they can see patients that are placed in this position. And if they can't see the black tag, at least they know that because they're in this position, they are considered black tagged. Remember, whenever treating patients in a mass casualty incident or active assailant incident, we're just going to treat any life-threatening injuries, right? So quickly open airways, tourniquet with a wound packing or chest seal. So we want to open airway, stop the bleeding, and then get them out of there. We're not going to start CPR. We're not going to start ventilating for these patients. It's very quick, down and dirty, life-threatening interventions, and then get them to the casualty collection point. So when we're extricating these patients from these scenes. Obviously, it'd be ideal if we have mega movers or backboards or Stokes baskets to move these patients, but we may not have that. Don't be afraid to utilize the things that you see on the scene to move patients. That could be a rolly chair, it could be a carpet, could be sheets, anything that around you that you could utilize to start moving patients off the scene into the casualty collection point. Please, by all means, go ahead and do that. So let's talk about some terms so that way everyone's on the same page. If you ever hear the word concealment, that essentially just means that you're going to be in an area that people wouldn't be able to see you, right? It's not necessarily protection. It's not necessarily that you couldn't get injured behind that. Cover would be something a little bit more protective, so you would be behind a wall, somewhere where you wouldn't necessarily be in the direct threat of fire or an explosion. Now, the ballistic protection equipment, those are going to be the vests, the protected vest that the sheriff department and other law enforcement personnel have, and some fire departments have as well. Here at Plainfield Fire, we've chosen to get different vests. These vests are essentially just vests that we're going to fill with our active assailant equipment, medical equipment, but they're not considered protective vests. They're just vests to identify us as rescue or fire personnel. When a scene is clear but not secure, essentially clear just means that it's clear of the suspect only. As far as they know, there isn't a known threat in that area, but that area hasn't been fully searched to guarantee life safety. So that's kind of the difference between clear and secure. Clear means, hey, the contact team went through there quickly and ensured that the suspect wasn't there and they kept moving, but they didn't go to every nook and cranny of that area. So the primary entry point is going to be the area where the rescue task force is going to be entering into the warm zone, kind of the path from the cold zone into the warm zone. Rescue staging is kind of self-explanatory. We've done a good job of that on the fire department side anyways. And that's going to be well into the cold zone and away from the incident command post, so that way we don't bombard that incident command post. Now, the law enforcement staging may be a little bit different. That's going to probably be a little bit closer to the warm zone. And what they say is they're going to have an aggressive staging position, kind of still to protect the area. Now, the link-up location is going to be where the law enforcement members and the fire department members link up, get together to form that rescue task force. The casualty collection point is going to be an area where we grab the patients from the warm zone and we take them to this location where we can start putting patients there, and they can from there be further moved into ambulances or to other treatment area. So that's going to be a casualty collection point. It's important to have those locations so that way patients aren't just being brought anywhere in the incident and then they can't be found by other personnel. The IFAC are going to be that essentially is just the medical kit that we have already. This equipment is going to be stored in our vests that say fire on them. Now our vests are red, they're a bright red, so we can be identified by police personnel, and they're going to be full of this medical equipment, which is going to be pretty nice. Okay, so this is what the actual scene would look like if there was an active assailant here in this location. So active assailant is going to be here. The contact team is going to be around neutralizing this active assailant. Obviously, the warm zone is going to be this orangey color. You notice that the unified command is going to be up here in the cold zone. Rescue task force link up is where the law enforcement and the fire department personnel get together, and then they would make entry in the main entry point here. Once we get patients, we would then move those patients up to the casualty collection point where they could be then distributed to the ambulance companies. We would refill our equipment if we had to use any equipment on the scene while we're in the warm zone, refill, and then re-enter into the main entry point. So there was a lot of discussion about communication and what channels are going to be used. So this is the preliminary communications plan that the Kent County Sheriff Department and the emergency manager put together. And as you can see, there are definitely a lot of different channels that are going to be utilized. I would expect that this would probably be, once it's well finalized, this would probably be made into some sort of a card, so that way units could have this and can quickly refer to if this incident happened. Okay, if you have any questions in the meantime, please don't hesitate to ask myself, firefighter for Stashi, DC Sabota. And like I mentioned earlier, as more information comes out, we'll start coordinating a practical portion to this, so that way everyone's on the same page. Again, this is meant to be more of an awareness level training.